Hello, my name is Svein Erik Måsøy. I am from the Norwegian University of Science and Technology, and today I'm going to talk about aberration correction in the Echo Lab, a clinical pilot. The project has been carried out at the Center for Innovative Ultrasound Solutions and represents a collaboration between GE Healthcare, NTNU, and the St. Olavs University Hospital in Trondheim. I would also like to mention that the aberration correction algorithm presented here, named ADAPT, was commercially released on the Vivid E95 cardiovascular platform at the European Society of Cardiology conference in August this year. This presentation summarized the work leading to this release. As a disclosure to the audience, I currently have a 20% position in GE Wingmed Ultrasound, manufacturing the Vivid E95 platform. State-of-the-art ultrasound imaging of the heart is a vital tool for diagnosis of heart disease, and this image shows a patient with very good image quality. Here is an image of another patient using the same ultrasound system, and here image quality is dramatically reduced. Seeing these two cases side by side, it is almost hard to believe they have been recorded with the same system, and this is perhaps the biggest challenge of echocardiography, the significant variation in image quality and what this entails for obtaining an efficient and robust diagnosis of heart disease. Now, there are many causes of image degradation in echocardiography, but in this talk I will focus on aberrations. Earlier research showed that a significant amount of aberrations arise in the human body wall, consisting of skin, subcutaneous fat, connective tissue, and muscle tissue. Important work from the University of Rochester has characterized and demonstrated this in various body wall types using resected tissue from humans. The various tissue types of the body wall has some of the largest speed of sound differences observed in the human body. These figures show histology stained cross sections of both abdominal and chest wall, and the table show the property differences of these tissues. The challenge when imaging through a heterogeneous body wall is that sound emanating from a point in space propagates to different probe elements through different tissue paths, sometimes also hitting bone. This causes arrival time and amplitude fluctuations on both transmit and receive, leading to aberrations and reduced image quality. This may be compared to smearing a thin layer of Vaseline on your camera lens. No matter how well you try to focus, the image will be blurred and contrast reduced. The purpose of aberration correction in this project is to estimate and compensate for arrival time fluctuations on receive only. I will from here on present the CU's ADAPT project. For all this work, we have used the Vivid E95 system with the 4BCD matrix array probe as a research and development platform. The E95 is a software beamforming system capable of storing raw, unprocessed IQ channel data. The 4BCD matrix array probe is a subaperture or SAP-based probe, where a number of elements are grouped into a SAP by electronics in the probe handle. The system stores channel data for each SAP with this probe. With channel data, we can reprocess images using a version of the GE C-Sound beamforming software implemented in MATLAB. We can inject custom processing at any stage during image formation. With C-Sound, we can also process data all the way to DICOM format and display them as they would have been by the E95, encompassing all state-of-the-art image reconstruction and post-processing steps normally performed on the system. Images may then be clinically analyzed in EchoPack, a standalone image evaluation and analysis software package provided with the E95. We started the project by recording a large image database from the Clinic of Cardiology at St. Olavs Hospital. All data were recorded by two of the co-authors of this work, both cardiologists in training. We recorded data from 106 patients consisting of one cardiac cycle from 5 standard views of the heart. This gave us more than 35,000 individual frames. With this, we tuned and optimized the ADAPT algorithm and came up with solutions to improve it. The algorithm is based on an earlier published version. The core of the algorithm is to compute range, average, normalized cross-correlations between all SAPs of the probe and the beam sum. Arrival time delays caused by aberrations are then found by filtering the correlations in the azimuthal direction with a convolution filter. The delays are estimated for each SAP for all transmits and all frames. Corrections were only applied on receive. The images presented in the following have been processed through the entire E95 chain and are displayed in EchoPack. Here we present an image case from our database before ADAPT is applied. Here is the exact same frame processed with ADAPT. By letting the images alternate in a GIF animation, it is easier to appreciate the quite significant effect of ADAPT. I should mention that this is one of the cases which have the strongest effect of ADAPT from our database. Displaying the images side by side in the cine loop, the effect of ADAPT is clear, although it is harder to perceive detailed changes in image quality with two running cine loops simultaneously. In the ADAPT processing, an entire frame of channel data is kept in memory. In this plot, each square shows the estimated time delays for the matrix aperture, the red letters indicating beam numbers. The grayscale values are given in nanoseconds. The delays are interpolated across the SAPs for display purposes. As may be observed, there are some variations of the delays across the beams, and there is a clear parabolic shape of the delay profile for many of the beams. In order to evaluate the efficiency of changes and tuning of the ADAPT algorithm, a coherence metric has been developed. I would encourage you all to follow my colleague's detailed presentation about this metric at IUS. Simply explained, the metric averages the coherence values in all beamformed pixels into a single value per image. The image quality parameter is here plotted without and with ADAPT for all frames in the cine loop. As can be seen, all frames obtain a significant improvement from aberration correction in this case. Having developed a working version of the aberration correction algorithm, we carried out a clinical pilot validation trial, recording a series of new data from 22 patients. We collected a total of 116 cine loops and 7,380 individual frames of channel data from 5 standard cardiac views. The results of this study are presented in this paper, currently available on the Tech Archive preprint server or IEEE. Here, I will briefly go through some of the results from the study. We processed the coherence-based image quality parameter for all frames, and the figure displayed the percentage increase in this parameter after applying ADAPT to the data. As can be seen, all frames were improved. In a blinded and left-right randomized side-by-side evaluation, 4 cardiologists, 2 experienced and 2 in training, evaluated image quality. The clinicians were provided with a view such as this and were tasked with selecting the image they preferred. They were able to slow down or to stop the cine loop and alter gain. The change in gain would then be equally applied to both images. Here is the summary of the evaluation. The clinicians preferred the ADAPT-corrected cine loops in 97% of the cases. 2 of the clinicians preferred the ADAPT-corrected images all the time. In 11 cases, 2 of the clinicians preferred the non-ADAPT-corrected image, but they only agreed on this in 1 instance, meaning that in 115 of the 116 cine loops, 3 out of 4 clinicians agreed that ADAPT provided the best image quality. In 1 case, 1 clinician found the images to be of equal quality. Comparing this with the image quality parameter, we may say that the clinicians validate what the parameter shows. That is, they agree that ADAPT provides improved image quality in almost all of the cases. In situations with very good image quality, it is not easy to see the effects of ADAPT in a side-by-side display, but this should also be the case. If there is little aberration, ADAPT should not correct much. Still, alternating between the uncorrected and corrected frames, there is also here a clear effect of ADAPT. In another example with very good effect of ADAPT from the study, we are alternating between the uncorrected and corrected image for the first 10 consecutive frames. The improvement in image quality is significant and shows how much ADAPT may improve images in a state-of-the-art echocardiographic system. Here is the cine loop of this specific case. The improvements from aberration correction are clearly visible in the right loop. Before the release of ADAPT, GE had systems in testing in several hospitals across the world, and I will round up this presentation with some of these cases. In this situation, the patients are scanned with two different systems, one with the current software and one with the new software. Cineloops compared are not identical, but the clinicians strive to obtain as equal a view as possible. The case shown here is from an obese patient with fairly low image quality. With ADAPT, the images are sharper, more stable, and has better contrast. ADAPT also runs in multiplane and 3D imaging, and this is a triplane view. All three planes are markedly improved in this case. Here is a 3D case where ADAPT improves the 2D cut planes and 3D rendering. It should be noted, and in the new release, GE has a new GPU with more processing power, also contributing to the improved image quality of the 3D rendering. To summarize, an aberration correction algorithm has been developed, implemented, and launched commercially on the GE Vivid E95 cardiovascular system. ADAPT has been tested and validated on more than 40,000 clinical images. ADAPT operates in both 2D and 3D with imaging rates of more than 150 frames and 46 volumes per second using factory settings for adult cardiac scanning sectors. In a pilot trial incorporating 22 patients, the clinicians preferred the ADAPT-corrected Cineloops in 97% of the cases. Finally, I would like to recognize my co-authors of this work. This has truly been a team effort from all institutions involved, and I'm just a lucky guy who gets to present the results. Thank you for your attention.